You're listening to the podcast between doctors and friends. Another episode of Between Doctors and Friends, and this time we're talking about holiday chaos. With me are my co-hosts, Dr. Ray and Dr. Foz, and then we have Auntie in the room with us. Have you ever experienced any chaos during the holidays?
Of
Um,
course.
What kind of chaos?
No, our lives are
like
perfect.
personal chaos?
Yeah,
Or
there's
personal chaos?
chaos every which way, personal, business, everything. So, specifically in the office chaos, there's always chaos in the office. People trying to, I think the biggest thing that we deal with end of the year is people trying to use their insurance benefits because they've already met their deductibles for the year. And so they're trying to squeeze in everything they can towards the end of the year. So surgeries that they've been putting off all of a sudden become emergent and they have to get it done by December 31st, or treatments that need to be done immediately. And it's sometimes very challenging and difficult to fit them in because hospital staff is lessened during this time because holiday hours are harder to staff, as well as in the clinic. We have the medical assistants who have been saving their PTO because they want to take time off during the holidays. And so we are often short staffed in the office, short staffed in the hospital, and to fit in all of these people who all of a sudden have emergencies, it gets very chaotic and very challenging.
Agreed. I get a lot of requests for things that must be done before the end of the year, and that's hard because it's already the end of the year, and so we can't fit even when you're talking like not reduced staffing issues and everything. It's like we don't. Everything's been booked. This is what happens when you wait to the last minute.
Right. We tend to book surgeries. Our cesarean sections, we book 3 months in advance, and other surgeries are booked usually a month in advance. So, coming in the month of December and saying, oh, when I was here in July, you wanted to do surgery on me and I didn't want it, but now I want it. And now it has to be done by, these holidays by the end of the year. And that puts it a difficult place on us. We have to get stat authorizations. We have to work with the operating room schedule. We have to work with our schedule. We try and accommodate. We obviously want you to get the treatment and the care that you need, but we're limited. We're limited by staffing issues. And what everyone always forgets, us doctors are humans too. We have Christmas shopping that we need to do. We have decorating that we need to do. We have family events that we need to plan for. And when it comes down to it, somebody who comes in on December 22 and needs to have a surgery done in the next 3 or 4 days,
Wow.
because they put it off, it makes it hard on us because personally I'm thinking, December 23, I have this time to go do this personal errand. I need to buy these last minute gifts and I'll do it on that day. And now somebody's coming in, complaining and wanting to have surgery and pressuring and badgering and doing all of this stuff.
Yeah,
And it's like, okay, what
and
do
that's
I
the hard
do?
part.
Yeah, what do
The
I
person,
do?
the badgering, it's like, hey, you know what? Um, I get it because I do think that some people have stuff that they also are busy and they can't schedule it until they have time off at the holidays. That also happens for the patients. But, when we've been telling you since April to do whatever it needs to do and you need it done before December 31st, that I know how this sounds, but that's not really my problem sometimes. It's like I can't. I'll try, but I can't get you in. I can't create time. And
Yeah.
people get mad about that.
Yeah, then it comes down to, for example, Christmas Eve, my office only works half day, and everybody's going to want to get out of there by 1 o'clock so they can go home and be with their families. They're going to be, wrapping last minute gifts, maybe trying to travel to, a relative's house, or maybe they're preparing their house because the relatives are coming. I'm the same. I'm just a regular person too. I have a family, husband, kids. I need to do all of that stuff for them. And now I have a patient who wants to have this surgery done and everything. And so the only time I have this week is to put her on, Christmas Eve afternoon. So I have her scheduled at 2 o'clock on Christmas Eve. And that takes away from my personal time. And it comes down to a balance of, am I a doctor first, or am I a person first? Am I a mom first, a wife first? And you try and accommodate, and you try and go above and beyond to help your patients because you understand that they need this and this is the time that works. And, instead of being home at 1 o'clock, I can be home at 3 o'clock. And luckily I have a understanding family that can kind of chip in, but it's just going to make my day that much more stressful and my day that much more chaotic trying to do this favor for this person. And oftentimes, the saying, every good deed goes, how does it go it's
No good deed
no
goes
deed,
unpunished.
no good deed goes unpunished. Exactly. And sometimes, I'll make all these arrangements and then the patient will last minute cancel, or the
Oh,
patient will,
Totally.
yeah,
Totally.
or the
really?
yeah, or the patient will have some issue or problem, or she'll be just unhappy and then she'll leave a bad review, or she'll be upset about something. And it's like, you know what? I gave up 2 hours of my Christmas Eve time to try and accommodate you. And you're not understanding, the conversations I had to have with my family to be like, sorry, I'm not going to be there on time, or sorry, I can't cook that dish that I always cook because I have to do this thing with this patient instead, or sorry, you guys are going to have to, do something on your own. They're
Go
just not,
without me.
right. They're just not
Uh-huh.
understanding the sacrifice that we'll make to try and help these patients. So, it does get very chaotic. And I think in the beginning of my medical career, I tried to always put the patients first and sacrifice everything that I needed to do. And I think as I get older along, and I think also as human nature is changing and patients are not as, they're just not as appreciative and they're more demanding, that I get less likely to want to sacrifice my personal time and do something
Yeah.
for
And
them.
it's not about that's burnout. That's how burnout happens, is when you put
Yeah.
somebody else's needs first above yours all the time. And
Yeah.
that's what we want to do. But there comes a point when you just can't. And it's not about like reviews and all that stuff. It's about really trying to accommodate somebody. Okay, yeah, I get it. Your deductible's high. We try, but like, but when it doesn't work out because because of staffing issues at the hospital, which you don't have any control over, and all these things. And all of a sudden, like, we're responsible. It's like that's just it's not reasonable. It really
Yeah.
isn't.
And it's
Wow.
not only in the
We have
hospital, it's in the office as well. Patients wanna all come in for their visits because they've met their deductible and they can come in now essentially free, and they
free.
wanna come in for all these problems that they've been having, and they wanna make a urgent appointment on Christmas Eve. And we're already, booked. We book up a few weeks in advance, and so we're already booked. And during the holidays, we are shortening our hours. We do want to accommodate our staff, and we want to accommodate ourselves to enjoy the holiday season as well. So we did block, a couple of days, and we're not, this year with Christmas being on a Thursday and the day after Christmas being Friday, we thought, we're going to get a lot of call outs from our employees, or patients are going to just no show because they're going to wake up that next day and be like, oh, I don't want to go to the office or something. So we decided to block that Friday and the day after Christmas so that, everybody can just enjoy being time with their families and we don't have to stress out about, having Christmas and then the next day working and then the next day off again. It just didn't seem just didn't seem wise. And so we have less time and then we're working half day on Christmas Eve. And so we just don't have a lot of time this week. So I know on Monday morning, we're going to get a ton of phone calls for people who have to be seen this week. And, we'll do our best to accommodate them. But a lot of people are going to be disappointed because we're not going to be able to fit them in last minute.
Yeah,
Wow.
it's also, well, I mean, the New Year's holiday also eats up a good chunk of that. There
Right.
was a question, there was a hand raised. Is that question still there?
Yes,
Well,
Auntie.
Dr. Ray actually kind of answered it for me slightly when she was speaking, but I was going to ask, especially when it comes to patients, when you discuss like needing surgery months in advance, like is this sense of urgency coming from like the insurance companies? And when Dr. Ray mentioned like the reaching the deductible, and so yeah, that led me to believe that yep, that's usually the case. That's where that
Yeah.
sense of urgency
Well,
comes
usually
from.
I'll see them in maybe the springtime, early summer, and I'll say, "Hey, I think you should have this surgery done. This is going to help your problem." And they're like, "Oh, I don't know about that. I don't know if I want to schedule it now. Plus I have when we run their insurance, we'll be like, "Okay, you'll have to pay, $500 of your deductible to have the surgery done." And they're just like, "Oh, I can't do that. I don't want to do that." And then throughout the year, they've gone to other offices or ERs or urgent cares or whatever it is for their family. And then maybe by November, they've met their deductible. So now they don't have to pay that $500. So now all of a sudden, December 20 rolls around and they're like, "Oh, I better get this surgery done now because I don't have to pay that $500 deductible. So let me call the office because they should be able to do my surgery tomorrow," right? Isn't that how it works? And so they'll call and be like, "We want to have our surgery done." And I'm like, "Well, we book out a month in advance, so it's December 20, we can do it sometime in January." And then they're like, "No, no, 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 it has to be done before December 31st. It has to be done." And then they get upset, and sometimes they get belligerent and they get demanding, and then they show up to the office and just saying, "I need to have it done now because if I wait till January, then I've got to pay that $500 deductible. But if I do it now in the next 10 days, I don't have to." But what they're not understanding is in the next 10 days, we've got Christmas Eve, Christmas, New Year's Eve, New Year's Day. We've got, holidays in
Skeleton
the
staffing.
office. Maybe we're doing a holiday Christmas party, and so we're closing the office early. My employees want to take a vacation. The doctor wants to take a vacation. So we're running, just skeleton crew here. So we can only do so much. And the same is
Even if
happening
you
in the
have a full
hospital.
staff, even if you have a full staff, you still have limited hours. That's the
Right.
problem.
Right.
So, I mean, it's been my experience that a lot of times it's not really so much staffing. It's really about the fact that everybody else has taken those spots already. They did that a week before you tried to.
Right.
Questions? There's a hand raised.
Yeah. So do you have like women that just they mandate to give birth, in December 25 or January, New Year's Eve?
You mean they want to be induced on those holidays?
Yeah.
Yeah. Not really. I think most people realize having a holiday birthday is not really fun. So
I
I think
saw that happen
most,
once.
yeah, I think
I did.
most
I had.
people,
I have to interrupt with this. I had somebody do that once because they wanted the child born in on December 31st and not January 1, so they could take the tax deduction. I swear to God.
that I get all the time.
Oh my
That I get,
gosh.
yeah. That I get all the time. But I don't get people wanting to be induced on Christmas or wanting to be induced on New Year's Day. They want to be, if they need to be induced, we try and work around the non-holiday time. But I will get a lot of people who are due maybe the first week of January who want and inquire about being induced December 30, December 31st, so that they can get the entire tax deduction for this year for that child. So we get a lot of that. Yeah. So yeah, I'll get a lot of that and everything. And again, every situation is different. We have to look at the risk factors for every patient to see if they, would be a good candidate for induction. And then, my hospital is a busy hospital. And so if, 2 or 3 or 4 people have that same thought and they take those spots for the induction, then there's nothing available. So then I can't say or do anything to the patient. And so sometimes the patients do get upset about that. Right. But these are people who, I mean, they're due in December anyway. So I think they've already sort of made their peace with that. Yeah. I mean, I think overall, if you can control and plan your pregnancies, then don't have a December baby overall. But not all pregnancies are planned. So when they, if their due date is January 2nd, they're like, well, can you just induce me on December 31st? That's just 2 days early. And then I'll get a full year of tax benefits. Yeah.
I am gagged right now. Like,
It's very, very common, very normal, everything. And so New Year's Eve is quite busy in the hospital for labor and delivery. Yeah. Uh, It's
Well,
commonplace. Yeah.
it's tied to like I often, kind of pondering this. I mean, I do see more of a push, like, can you get me my referral to this specialist? Can you get me in? I've been putting it off, but now I want to see somebody because my deductible's that now I don't care. And it's like, but I can't also, when I have to do a referral for that, like I can't guarantee that the orthopedist or the gastroenterologist or whatever is going to be able to see you. Like I can request it, but I can't guarantee it. And so there's those issues. And I see this a lot in primary care when people, I end up knocking myself out for this, and so I'm getting to a point where I might not kind of pursue it quite as aggressively because it's just so exhausting. I have this lot happen, not so much with holiday stuff, but I mean, obviously the new year throws in a wrinkle with that because most insurances change or lose coverage or whatever on the first of the month, right? So if you switch insurances, like it usually takes place at that point. And so not just in December, but people will come in and they'll be like, okay, so I'm here for whatever, but I lost my job or something, and I'm losing my insurance on the first of the month. It's like, the 20th or whatever. And I need to get everything I can get done before then, or else I won't have insurance. And so for me as a primary care provider, I'm like, okay, where are we, like where's your mammograms, where's your colonoscopies, like where what vaccines can I squeeze in before you lose potential insurance, especially when you ask like, are you going to have new insurance, and they're like, I don't know. And that's like a terrifying kind of thing because like I feel like I'm sending somebody out there in the world unprotected, and I can't protect them. And so I'm like making sure they have copies of relevant tests to take to whoever will be assuming care if it's not me. Like here's your PAPS report. Please take this with you because you need to have it done in 3 years. And I don't know if I'll be your doctor at that point because you don't know what you're doing with your insurance. And trying to get them in for last minute things and I mean, I did this once. I like practically knocked myself out to get this person's colonoscopy done. I ended up having to call um, the gastroenterologist and just sort of beg and plead and be like, look, this poor patient's never had their appropriate screening, despite having been referred multiple times in the preceding few years. And now all of a sudden is motivated to do it because they're going to lose their insurance. And so it's like, can we at least try to squeeze them in? And we managed to get everything done, but it's like, it's super stressful because like, I'm like, okay, not only am I trying to deal with whatever's in front of me, like, okay, you're also complaining about your knee pain or whatever it is. Now I'm also what now, like, okay, can I even get your study done? Can I even like what can I get, at what point can I feel like I have to get them signed, sealed, and delivered and ready to be passed off to whoever will be caring for them next, if anybody, you know um before I lose access to them. And that's kind of like the terrifying part of insurance.
Yeah, I'll get that throughout the year because everyone's insurances are always changing. So I'll get that like around the 20th of most months, and somebody will come in and say, I'm losing my insurance at the end of the month and I needed to get this stuff done. So, I mean, we like, again, we try and accommodate them as much as possible, but there's some things that are just out of our control. And I explain that to them that it's not in my control, but whatever is my control, I'll go ahead and do as much as possible because it's a terrible situation to be in. I've had family members who have been in that situation where they've lost their health insurance and they only have, a month left, and they're trying to, get whatever they can get done before that time so that they could go for the next 6 months or so and hopefully be healthy enough to not need health care until they get their next job or next health insurance policy. So it is tough, but I mean, we do understand that, we are united with our patients in our hatred and contempt of the insurance companies, and we want to help you get whatever care you can get, in a timely fashion. And I wish all of your healthcare decisions were up to me and I could make them solely with you and I having a discussion on what you need. But oftentimes the healthcare decisions are not up to either of us, and we have to be at the mercy of the insurance company. So, I just tell them I'll try and do whatever I can, but a lot of things are out of my control.
Okay. And I know I'm trying not to choke and laugh. What fans?
I know. I was like, oh,
That
she has
was
fans. I don't
extremely
have
funny.
fans.
I know. What fans?
I know. I was like,
It's
oh.
quite okay because I couldn't even tell Dr. Fosbulus.
I keep muting it every time I cough.
But yeah,
Fans? Oh my God, I have to do this so I can laugh some more.
the holidays can be, pretty stressful in the office, but they also can be very fun. People get into the spirit. I love the decorations in the office. The hospital always has beautiful Christmas trees and decorations, and they're probably professionally done. So it's a beautiful time of year, and it's a very happy time of year. And there's always food on every
Staff
corner
potluck.
of every
Staff
nurse's
potluck.
station. And so every department is having a potluck at some point, and every department is having a little, waffle breakfast or something going on. So it's fun, and it's a
Nurses.
fun time. And my office, we have a Christmas lunch, and it's a good time for everybody. And the patients in general, they're happy when they come in, and they often will bring a little treat for the office, which is much appreciated. Sometimes a little gift for the doctors, which is also much appreciated. And so it's a fun time of year. It's a good time.
Nurses are the best people to potluck with because they're so used
Yes.
to taking care of everybody. They
Yes.
will feed you. Like
Yes.
it's
And
nobody's business.
it's mounds and mounds of food. Like, I love the nurses' potlucks. They're the best.
They're awesome.
And because also a lot of the nurses are Filipino, that's where I get my Filipino food fix, because that's where they bring in the pancit and the lumpia and everything. And I'll go down and I'll be like, oh, this just feels like home. I'm like, it's so yummy.
Good stuff.
So, well, the number one recommendation for all medical students and young doctors is be kind and respectful and friendly to the nurses. The
Always.
nurses will make or break your day, make or
100%.
break your career. So they are the
Yes.
ones that you go into and you are like, you are going to be my new best friend. I love you. I respect you. Whatever you say goes. Whatever you need, tell me. It is whatever
Well, do
whatever
you
you
have that
need.
working relationship though? Like, when you're working with newer nurses and stuff, like you'll kind of get a feel for things. Like, when you're new in training and all those things, like they will guide you because I remember standing in the intensive care unit being like, holy cow, what am I supposed to do? I'm a second year resident. This
Right.
person, what the heck am I supposed to do? And then you have a nurse, the CCU nurse or something who's been there, who's been doing this for like 25 years. And so I've been doing this for 20 minutes. They've been doing this for 25 years. They're a great
Right.
source of information. You're like,
Right.
I think I'm going to do this. And they'll be like, yeah. And then you can also think about this and that, the other. And so it's,
Yeah.
it's always my decision, but they are willing to help you.
Right.
And then you get to know who to trust and who not to trust. So if nurse so and so calls you in the middle of the night, there's a real problem. Or if
Yeah.
nurse so and so doesn't call you about somebody that you're worried about, we know everything is fine.
Right.
So like, you kind of
Yeah.
get to know them, but
Yeah.
they will, nurses have nursing hearts, and they will take care of you.
Yeah.
As the provider, they will take care of you.
Yeah. So there's always food, there's always candy, there's always something. So the hol I mean, that's a lot of times of the years too, but it's more at the holidays time. So every like I said, I my floor is in the shape of a square. So we have 4 stations at each corner, and I'll go from station to station, and it's just donuts at this station. Next station, it's holiday cakes and pies. Next station, it's so I'm just like, "This is the best day ever." So it's fun. I mean, the holiday spirit definitely comes through. It makes it a lot more
Yeah,
joyful at work.
I like working
And
holiday time. Yeah.
also, yeah, there has to be nurses and doctors working on Christmas Day in a hospital, and so when you go there, everyone knows, "Hey, this really sucks for all of us to be here working. We're all away from our families, which really sucks. So we're gonna make today extra special and extra fun and extra everything." So we'll start with food, we'll play some music, we're all gonna be super friendly to each other, super supportive, there's gonna be no negativity today, and it feels like it's a happy day. I aside from missing my kids and family, I don't mind working holidays because you go in there and it almost feels like this is like a party environment. This is fun.
Yeah, the attitude is
Yeah,
different. Yeah,
yeah,
the attitude
it's
is different
different.
because we're
It's
like,
different.
yeah, the attitude is like, oh, we're just in this together,
Right.
so we just make the best of it, even though we'd rather, be doing our holiday stuff. So it is,
Right.
it is a different vibe.
Yeah.
Absolutely.
Right. Ugh, don't get us started on that. But
Yeah,
yes.
that doesn't apply to us, just so you know. It also depends on where you work. I had worked one place where a lot of the other providers I worked with were not of Christmas celebrating faiths. So they were perfectly fine working over the holidays.
Right. I have one in my practice now who takes, since she has joined us, has taken Christmas every year because she would rather have Thanksgiving and New Year's off because she celebrates those, but Christmas is not on her radar. So that
Mhm.
makes it very, very
Right.
nice.
So we can share the love. And so when there's
Right.
other important holidays that don't impact my faith or my cultural habits, then I'm happy to
Right.
to hard to know what's going to
Right,
happen.
because everyone's home with their family, maybe you wake up in the morning and you're like, "Oh, my stomach kinda hurts, but you know what? We gotta do presents, and we gotta do breakfast, and then the in-laws are coming over, and okay, now it's 5 o'clock and everybody left, and you know what? My stomach still hurts, and now it's still hurting more. Okay, now it's time to go to the ER." So, yeah, the Christmas date time is generally slow. Even on labor and delivery, we don't get a lot of the complaints of the people coming in like, "Oh, I think I feel some contractions," or "I think my water broke," or "I think this," they come in only when they're seriously in labor. So it is a nicer day to work because you don't deal with a lot of that, um, those
Fluffy
visits
stuff.
that may be, not necessary. And then also there are no visitors in the hospital either because everyone's home with their families. So the hospital is quiet. There's just not a lot of chit-chatting and people in the hallways and crowding around the elevator, the cafeterias. People are home with their families. Maybe they'll come by a little later in the evening to visit the sick relative who's in the hospital. But for the most part, that's they don't, you know, a lot of people
Well,
don't come.
that's what I also think is an issue, though. I mean, I've had because things are. I don't want to skeleton staff in a way, right? It's just definitely not as usually as full service and
Right.
robust as normally. Bad things can also happen. I remember very clearly I had an older patient who had a very serious medical diagnosis. It was this completely complicated situation where we started the workup as an outpatient and we ended up being admitted to the hospital urgently. There was back and forth, and this poor person was sent back to the hospital. Pretty much every time I saw this person, I was like, "You go back to the emergency room because this is serious. It's terrible." Was admitted to the local hospital. The family didn't like what they were saying, so they took the patient out of the hospital against medical advice, put the patient in their car, and drove them about 60 miles away to a bigger hospital. And that's where that patient was admitted and had received like definitive treatment, which I think should not have been done. I'm just going to say it. I think the patient the patient should have been put on hospice. Like this is not a fixable problem. I think you created more problems than you fixed, but that's my opinion. And then the patient was discharged from the hospital, which on like Christmas Eve, and they're elderly and they've been in a hospital now and had a major surgical procedure and was in the hospital for like 2 weeks. So what happens with a lot of older people who are more frail, which this person was, when you put somebody in a hospital like that, you put them in a hospital bed for even something, let's say, relatively simple. They're admitted to the hospital for pneumonia and we're just being cautionary and we think they'll be okay, but we want to make sure they're okay. And now they're in the hospital, they're getting IV antibiotics and oxygen, and they go home 2 days later, but they've been sitting in a bed for 2 days. Now they can't walk. And that's really hard for people to understand. It's like, of course, the 25-year-old granddaughter doesn't understand that because the granddaughter's 25, right? Well, you take the grandmother who's 80 and do this to them, like they can't walk. Now they have to go to rehab, or now they're falling down, and it's just this terrible thing. So this person had had way more happen and was discharged from the hospital on Christmas Eve, and there was supposed to be all kinds of follow up. And remember, this is unbeknownst to me because this is, by the way, the hospital that they took him to was out of their insurance network. So it's this whole big thing because nobody knows what's going on. And this person was discharged from the hospital on Christmas Eve and was supposed to have like immediate home health follow up. Like a nurse was supposed to see them the next day. And they were supposed to get started in, physical therapy and all these things. And none of those things happened because it was the holiday. And I get a phone call like a week later, like, yeah, so like, and remember, this is all happening when I have no idea. I don't even know whether they're at the hospital. Like, I don't know what happened. Um, yeah, so and so's, my parent is like in bed and we can't get them out of bed. And now, how do we get them to the bath? What are we supposed to do? I mean, it was a total disaster. And it's because a lot of this person was discharged home over a holiday weekend. And that would have not happened if this was at another time of year. And so, of course, that I think is not really, it reflects badly on the hospital they're at, which is a major, major institution. But it's just what happens when there's skeletons crew and nobody available and nobody's dotting their I's and crossing all the T's. And what I'm going to guess is most likely the primary team who was taking care of this patient was off for the holiday. And so it was some poor resident who was covering. Nobody knows what's going on, and that's what happened. And so it was really difficult getting this patient back to a better functional status. I had to. This was well, this um this I'm trying to shield all identities here, right? So this person had a very serious diagnosis that was in part hidden because of the patient's, I think, rather severe underlying dementia. This was a new patient to me. Literally, the first time I saw them, I'm like, you have to go to the emergency room because your blood pressure is 80 over 50 and you're falling. Like, I can't, like, you have to go to the hospital. And then it was, and during that whole discussion, it was, by the way, we just had labs done internationally. Please take a look at these. And there was a stuff that was like, well, that's not 100% normal, but it's nothing definitive. So this person ended up having a very unusual diagnosis and had to have a very unusual surgery. And I felt like this person wasn't a candidate. Um, it wasn't a great choice. You don't do this type of surgery in somebody who has like pretty severe dementia. And see, that's the thing too that happens with memory loss issues is I think when you're around mom or dad or grandma or grandpa or something, and you see them every day and they're a little loose around the edges, you don't really notice it because it's gradual. It's not like most people are fine one day and they wake up the next day and all of a sudden they're kind of confused. I mean, that can happen. That's a lot more serious, but that's not what I'm referring to. And I think the family didn't realize just how bad this patient was because they were around this patient all the time. But when I don't know this person and when you meet this individual, you're like, okay, clearly we are not really firing on all cylinders here, right? And so that just contributes to more problems, like worse outcomes and everything. And so this patient had a major surgery done, and I think it was done. I don't think I know how this sounds. I don't think it was done really only in the best interest of the patient. I think it was done as a let's see what happens and let's teach the residents how to do this kind of surgery because it's weird surgery. Like it's not something that happens all the time. I just think it was a really bad move. Like I understand. I'm sure that at the heart of it, I like to think that the specialists were trying to do what they can to save this person's life. But I think it was like way too far gone. Like you can't, it's not fixable. Like you can't, doing that surgery is not going to prolong the outcome. And so this person had a major, major surgery. And so when I get reported this later on after what had happened, discharged from the hospital, no appropriate follow up, high risk patient, I wasn't notified. I don't, because they don't know who I am, because nobody knows anything. Like it was just a big mess. I actually called over to speak to the specialist. It's a surgical oncology specialist. And I'm like, can I speak to Dr. So and so? And they're like, yeah. And so I started talking about the case with Dr. So and so. And I said, did you realize that this person is not really, is got some most likely underlying dementia? And in my mind, I think it was Parkinson's. But I don't honestly know. There wasn't enough information. And I think that, do you know that? And they were kind of like, no, we were focused on this part of the body. And I'm like, well, I don't, you should not have done this surgery. I think it's really bad. And I also think that this patient was sent home from the hospital without appropriate follow-up. Like there wasn't any urgency involved. What had happened, you don't discharge somebody at this age group with these medical problems over a holiday weekend and be like, good luck, because over the holiday weekend, that means I'm not available, right? Like or a holiday break. Um, and I just basically said that, and the doctor was actually on a speakerphone doing a procedure. So I basically chewed out the physician, which I normally would never do, but in front of the entire operating theater.
That's hilarious.
You should not. This was not. I don't think you needed to be a genius to know this should not have happened. Like I think, and of course, what happened was the poor patient had a difficult time and died 6 months later anyway. So I know, happy holidays, right? But it's just, yeah, it's just, so whenever you talk about to our host, like holiday mishaps or holiday stuff in the, that case always comes to mind.
Because they don't know what to expect. I'm in the operating room all the time. My phone rings and I don't know who's calling me. I don't know if it's about a patient. I don't know if it's a nurse calling me that I have a patient who's about to deliver or somebody having, some problem. So usually when we walk in, we put our cell phones on a stand, and the circulating nurses will pick up the phone and answer and say, Dr. So-and-so's phone, she's in the operating room, and the person will say, okay, I'll call her back, or, tell her that this urgency is happening. And sometimes there's a difficulty getting, a telephone tree. She's telling something, the phone person is telling something to the nurse is telling something to me. So I'll just be like, just put it on speakerphone so I can get the direct information. And then I'll be like, what's going on? And then they'll tell me on speakerphone, what's going on. And especially if it's somebody that Dr. Foz knew, maybe they had her number saved and they knew it was a doctor calling. Out of respect, we always answer when a doctor calls. So they'd probably be like, oh, it's Dr. Foz calling, please answer that phone. Not expecting to be chewed out, but probably expecting.
It wasn't somebody I never remember. They're out of my network. I've never dealt with them.
Okay, yeah.
And it was also, there was so much more tied to that. It was like the poor discharge work, and then also like they didn't do their due diligence about a lot of stuff, and and it was a way more complicated thing. And also, what was really frustrating too, I think it was also because To be fair, the specialist I think was operating off of a lot of what the family was telling everybody. And the family, it's like I understand this is your loved one. We have all the sympathy and all the understanding of that in the world. But what the family is also in denial. So like in the interim between the discharge and the passing of the patient, I would get the patient. I've been so what's going on? How is everything? Are the surgical margins clear? What's the plan? And the family was very much like they said that they got everything. This is totally fine. Like we are okay. Person's doing great. Carry on. We're so happy. So much more functional. And I'm kind of looking. I'm like, this doesn't look much more functional. And then I would finally beg and cry for the notes from the treating specialists, and they were like, yeah, widespread metastatic disease and blah blah blah. Like it was just like, well, did they tell you this? Like, I mean, it's just there's so much disconnect between what you're telling me and what I find out a day or two later when I'm finally able to get notes from a specialist. And it's like, how am I supposed to bridge this divide? Because clearly, most likely, this is what happened: is the family's in denial, and then the specialists suck at communicating. That's what the problem is. And then I'm stuck in the middle. Like I often feel like I know how this sounds, but I feel like a kid and mom and dad are fighting. That's how I feel. And it's just like, okay, I have to kind of figure out what the truth of the matter is here and like how I'm supposed to help the person in front of me when it gets to be really messy. So that's what I always think about when we talk about holiday snafus or holiday issues. Because the really, I think what had happened was they were discharged too soon from the hospital over a time that was like really poor for getting follow up. I do. I don't know if it's different for Dr. Ray with like a designated on call person.
Yeah, we have call
Um,
coverage, so all the calls and texts should be going to them. So I very rarely will get it, but if I do, it's usually maybe a logistical issue that I can just solve quickly. It's usually not a patient care issue.
I do because it would be things like um, I'm always open to my specialist contacting me that I'm totally fine with that, even if it's whatever, if it helps them to just talk to me directly first, as I think, and that helps the patient, then I'm okay with that. But I have gotten calls from like the hospital. The hospital has my mobile, but they don't know that I'm not on call. So they'll just call me. It's January 1st, everybody, and they'll just call me and start talking about so and so who's, and I'm like, well, all right, I guess I'm taking this call, and so it happens. Okay, I don't mind. Like I don't mind, though I do think that I have some people in my sphere who think that because I'm a doctor that like I'm also at their personal disposal. I have one friend who like lately she only contacts me when she wants medical stuff, and she'll be like, "So can you find a refill for me for this? Thanks. I need a note from my gym. I can you write a note for me? Thanks." And it's like, wait, this is starting to feel a little abusive. That nugget.
Quick little texts, I don't mind. I'd rather my friends text me something than to find out, many weeks or months later that something happened. So that I could have been like, oh, why didn't you ask me? I would have told you what to do. So I don't mind a quick text or something like that, just like, hey, XYZ is happening. What do you think I should do? And then I'll just text back, this is what you should do. So I don't ever mind that. I think that's part of the benefit of being friends with a doctor, like, being friends with a lawyer. Maybe you text them a couple questions every now and then. You're an accountant, it's tax season, an accountant, can I deduct XYZ? I would feel like that's the benefit of being friends with somebody who does that job. Obviously people
Yeah.
who abuse it, who are like, hey, can I get a prescription for this? Can I get a prescription for that? Can I do this? Can I do that? After a while, it might just be like, that might be a little a little bit too much that they're asking. But otherwise, yeah, I don't mind it at all. Yeah.
Yeah, there's a whole thing like you're really ethically you're really not supposed to practice medicine on people that you have a personal relationship with. Like that's not really okay. Like
Yeah.
you're not really supposed to manage your friends and your family. Though I think it happens more often than, it's not like um something terrible. It's just that you can't remain objective.
Definitely, other countries might have different rules of treating people and dispensing medications and stuff like that. But yeah, it is a little bit hard. I mean, you know, somebody maybe has a UTI and they need an antibiotic, nobody's really gonna be down my throat about that. But, when we get into narcotic situations and Schedule 3 drug situations, then it's a little bit more, um, more worrisome, so to speak. Yeah.
Well, that's different because I've known your dad forever, so that's different. So I know that's it's closer ties and stuff, and I'm not like I I feel like it's part of my responsibility to share to help people, whether or not it's I'm being paid for it, whether or not it is I'm giving him advice. Well, giving him advice isn't hurting him; it's giving him, and then also, like I said, if I can, attach my degree after my name, if that gives me any more street cred, then
Yeah.
of course I'm going to try to help him.
Yeah. And that's also, I
Mhm.
mean, we care about our friends and family, and we care about our friends' families as well. So it's
Yeah,
not so much me being a doctor telling your dad what he should do. It's more me being like, "Hey, you're my friend's dad. You should probably do this, and I know that you should do this because I am in fact a doctor. So I would want you to do this because I don't want anything to happen to you."
yeah. I'm much more. I'm very protective of my inner circle.
Yeah.
Very, very protective
Yeah.
because I've seen stuff. I've seen the other side of it when you have poor medical decision making, or just like I was saying in that last case, like miscommunication. It's like they really didn't understand stuff. And so sometimes it is just miscommunication because of time constraints and cultural
Yeah.
barriers and language issues and a million other things. And so if I can bridge that, of course I will. Get your vaccinations, get your COVID and flu shots if you haven't done that already. How about that? Get all of the recommended vaccines for your age group or for your situation. Nobody is trying to poison you with vaccines. Um, get your recommended screenings and don't be uninsured.
Yeah, I would agree with that. I would just say make an appointment. Like just come in. I think that's the biggest thing, the biggest obstacle people have. Like they just forget to make an appointment, or they just don't want to make an appointment. They just don't want to come in. Just make your appointment and come in, and we need to figure it out. It's hard to generalize everything, but I think make an appointment with your primary doctor or your gynecologist, and you can go from there.
Yeah, oh, I can go on and on. It's a chronic ongoing problem in this country. It's an ongoing problem. I don't know what's going to happen with Obamacare that has opened up access for a lot of people. I think there'll be a lot of people who are uninsured. What I will say about that, though, as somebody who has some experience in working with patients who are underserved, um, regardless of political leanings, this is not about political leanings, but it's really about access. With Obamacare, there was a huge movement away from like free clinics and all those types of things because so many more people had access to things. I think it's just going to go back to community resources having to pool together if there's loss of coverage for a lot of people. And then also, that's the other thing I would say. I think that depends on where you live. I have to qualify that. But there's always some place that you can get help that there's often community clinics. There is, you know, I once again I not Planned Parenthood does a lot of, I don't know about now, but they do a lot of care for patients that is not related to reproductive health. So
Majority
there's,
of what they do is not reproductive issues. I
so
think
there, that's there.
90% is not abortion care, which people just do not understand.
Right. So like if you have, if you had an abnormal mammogram that needs a follow-up and now you don't have insurance and, you can't afford to pay for these things, which most of us can't, Planned Parenthood might be able to help you out. So then there's a lot of like places that are like community clinics where these are places that are often funded and staffed by like local entities, counties, cities, the state sometimes, depending on where you live, where there's some place that you can get care for something that's an ongoing or serious issue if you don't have your own insurance that can cover it. And I think sometimes people don't realize that, so you have to do digging. It really depends on where you live. And I'm sure it's quite variable for different cities. But even things like that, like most states have university teaching hospitals, and they will tell you where those things are. You can contact them. Like local hospitals will tell you where to go. You can just call them, like, be like, hey, do you have like an outsourced educator or something like that? Like there's stuff that's available. You just have to ask.
Right.
And that concludes this episode of Between Doctors and Friends.